Hi, my name is Dylann Volz, and for my Science Honor Society project, I decided to research and look into various types of oncology treatments and different methods of treating cancer in cancer patients. So there are many standing and upcoming treatments and methods into removing or minimizing cancerous cells and tissues in patients. Different biotechnological and medical researcher teams are looking into ways to treat cancer. Four specific areas of treatment that I looked into were the use of medicinal plants, radiation, chemotherapy, and the surgical removal of tumors and or cancerous tissues and cells. First, I began with medicinal plants. The first type of medicinal plant that I looked into was Tinospora cordifala, which is also known as the heartleaf moonseed plant and is found in India, Myanmar, Sri Lanka, and China. A specific extract of this plant was given to mice and was found to have different anti-cancer activity in it due to its TCE, which was a compound in a plant, which was shown to have a radioprotective role by significantly increasing the body weight, tissue weight, and tubular diameter in order to inhibit the harmful effects of radiation on the testes in male mice. So when this plant was given in its particular extract of TCE, it was found to have reversed kind of the negative effects that radiation does have, as radiation can kill healthy cells, but it was able to decrease the harmful radiation concentration in the testes. Compounds of TCE have been reported to decrease antioxidant activities, which confirms its anti-tumor effects in the use of its particular extract of this Tinospora cordifala. The next type of medicinal plant that I looked into was the Phyllanthus armaris, which is found in tropical Asia and is known normally as the stonebreaker. The whole plant has been used for its medicinal properties throughout history, but it is found that different substances in the extract of this plant may exert anti-tumor effects. Research shows that the oral administration of this medicinal plant and its extract significantly increased the lifespan and reduced the tumor size in mice that had Dalton's lymphoma. In addition, it also had chemoprotective properties, and it may be related to its ability to decrease the activation of cancer compounds, which would be very helpful in giving chemotherapy to patients. It also has been reported to result in a significant decrease in a specific type of induced tumor. There are different effects of using these two types of medicinal plants. In both, they affect the blood sugar level in the patient, so it would be cautious in using these two particular medicinal plants if the patient does have diabetes. It is best that a patient does not take either of these two types of plants 2 weeks before surgical procedures, as blood sugar levels in the effect during a surgical procedure would not be beneficial. It is also advised that no children, pregnant women, or nursing mothers use this medicinal plant in their lives or any sort of treatment due to the fact that it does not have enough research or evidence to back up the fact that it is safe for them to use. It also T. cordifala can also affect the immune system and cause it to be more active, and as can Phyllanthus armaris. The next type of treatment that I looked into was radiation. Radiation, just as an overview, radiation therapy kills cancer cells or slows their growth by damaging their DNA. Cancer cells whose DNA is damaged beyond repair will stop completing mitosis or stop dividing, which would cause them to die, which would help eliminate the cancer in this patient. When they die, they are break down and removed from the body, and this helps the cancer to be removed from the patient. So obviously the radiation therapy does not kill cancers right away, as it takes days or weeks of treatment before the DNA is damaged enough to be removed. So depending on how much you receive chemotherapy would depend on many different factors, including the type, size, and location of the tumor, and how close it is to sensitive parts of your body. Radiation therapy may be given before, during, or after other treatments, including surgical procedures, and even they can give you radiation during your surgery so that it can go straight to the cancer without passing through the skin, and this is known as intraoperative radiation. So doctors can give you radiation through various types of surgical procedures or just as a treatment on its own to be able to remove and stop these cancer cells from continuing to spread. There are two main types of radiation, which would include external beam and internal beam radiation. So external beam comes from a large machine. Obviously, that's something that most people think immediately when they think of radiation, and a specific type of it is 3D conformal radiation. Internal radiation is known as, there's different types including brachytherapy, and there is also different ways to insert it through a tube, IVs, or just in an oral administration of this particular radiation. There are many side effects of using this, including nausea, mouth sores, and throat problems. It also can cause you to have different bladder irritation, frequent urination, and other negative effects. The next type of treatment is surgery. An overview of surgery. So the surgical removal or minimization of cancerous tumors has many different approaches or techniques to relieve the patient of their cancerous body structures or even symptoms. So it is particularly not meant for the use for leukemia, which is a type of blood cancer, or cancers that have spread very far, but it can be useful in taking out just a centralized tumor that is very compact and tightly connected and not too spread out far. There are different types of surgical treatments, including cryosurgery, which is extremely cold temperature of liquid gas that can help remove the cancers. There's laser treatment, hypothermia, which is high temperatures, and photodynamic therapy. There are side effects, as there is to everything, of using this type of surgical procedure, as just having any sort of surgical procedure always has negative side effects, including internal bleeding or just even nausea and pain in the area that was operated on. The last type of treatment that I looked into was chemotherapy. An overview: chemotherapy works by stopping or slowing the growth of cancer cells, which can grow and divide quickly. Chemotherapy is often used with many different types of treatment, but it is usually not used by itself, but it made the tumor smaller before surgery or radiation therapy, and it also aims to destroy cancer cells that may remain after treatment with either surgery or radiation therapy. So there are different methods of receiving chemotherapy, which include getting an IV, a micro pump into your arteries, depending on where the location of your tumor is. There is just a simple oral, which is oral receiving chemotherapy, which just comes in pills, capsules, or liquids. And there's also different types of creams if you have some sort of skin or on the surface cancer, in that a chemotherapy treatment of that nature would be helpful. There are also many effects in using chemotherapy, and how you feel is basically based on the type of chemotherapy you're getting, and it can cause different diarrhea, sores in your mouth, urine and bladder changes, kidney problems, weight and mood changes, nausea and vomiting, and it just mostly depends on where you were given this chemotherapy treatment, will based on the side effects that you do receive from it. To conclude, each of these different methods of treatments are proven or in the process of being proven to be effective against various types of cancers. Majority of the time, the treatment that the patient will receive mostly depends on the location of this tumor, the size of the tumor cancerous area that they possess, or even just their medical history or other procedures that they have had on different areas. While these methods are delivering or planning to deliver positive results in the way that they control the growth and symptoms of cancer, scientists are still looking into different methods and treatments and improving the efficiency and effectiveness of the older methods. The work of these brilliant professionals is saving and preserving lives, and these developments of cancer will one day be able for us to be able to say that we did beat cancer. Cancer has taken many lives, and it is something that is not fun. And as knowing someone who has people that have gone through having cancer and going through all the processes of chemotherapy, radiation, surgery, trying all the methods, it is not fun. And just one day, hopefully, I will be able to either help these patients, or these new procedures will be able to help patients save lives. We're excited.